Hello, in this video we will discuss about the electrocardiogram. So the electrocardiogram, after the understanding the electrocardiogram, we will also learn the cardiac muscle action potential. So first of all, we should need to understand this is a diagram of heart which that contain a right and left atrium and right and left ventricle, a superior vena cava and inferior vena cava, and this is a black color show the sinoatrial node and atrioventricular node. The sinoatrial node is used for the contraction of atrium, while the atrioventricular node is used for the contraction of the ventricles. So this is basically is the Purkinje fiber which that is travel the left and right bundle branch which that is arise from the bundle of His. So the bundle of His which that is basically is the converged into the left and right bundle branch and the left anterior division also. And in this way, this is the Purkinje fiber composition and the left posterior division also. So remember, one more important thing is that the left ventricle, which that contain thick wall of the muscle of the cardiac muscle, is used for the contraction more strongly for transmission of the blood throughout the body. So anyhow, let's begin to understand the major diagram of the heart for understanding better. So this is the aorta, and this is the superior and inferior vena cava, which that is collect the deoxygenated blood move toward the right atrium to right ventricle, and this is the basically when move and the pulmonary artery, which that is transmit the blood into the lungs, and after this it move to back into the pulmonary vein to what the left atrium to left ventricle to the move to the aorta to body for the oxygenation. So anyhow, this is the heart, which that is heart is the bigger diagram to understand well. So let's here is the sinoatrial node, and this is the atrioventricular node, and which that is travel the bundle of His toward the divergence of the basically is right ventricle and left ventricle to the Purkinje fiber. I am not explaining again, so you can understand. And in this way, you can here is the pulmonary vein and left atrium and right atrium and left ventricle and right ventricle. So anyhow, let's here we will understand about the electrocardiogram, how to put the electrode and show the graph. So how the graph will produce and what is the function of graph we can understand. The normal electrocardiogram we will discuss here, just because we are not going to understand the complication, just normally we can understand the electrocardiogram. So this is the P wave which that is showing the vertical show the voltage while the time show the horizontally. So the P waves, Q waves, R waves, S waves and T waves. So the P waves which that is after the depolarization of the sinoatrial nodes, and this depolarization will travel to the nerves and toward the atrioventricular node to show the Q waves after the contraction of the atrium. After the contraction of the atrium, both atrium, while so you make sense this is both atrium to show the Q waves. After the Q waves, basically the R waves which that is produced the more high because the ventricle should more contract for the transmission of the blood throughout the body as well as toward the lung through pulmonary vein. So the T wave shows the ventricle contraction slightly, and after the relaxation, basically the relaxation. So in this way you can understand the atrium will relax. When the atrium will relax, so the Q waves will produce. So anyhow, let's begin to understand. Here is the electrocardiogram how to treat. So this is the left and right arm, right and left leg, and this is the V1 to V6 which can put in the diaphragm of the person, which that show the correct ECG if the person heartbeat will be correct due to the depolarization and repolarization. If the blood circulation toward the heart, the coronary heart disease, which that will lead to change the heartbeat. So here let's begin to understand the cross section, which that show the lungs, and this is the back and front region, and the cross section, and this show the heart in middle, and lungs, pair of the lungs, and we can put the electrode in the different region for understanding, and in this way this is for the detection due to the depolarization of the heart cell, heart myocyte. So this is the V1 to V6. The V1 is the fourth intercostal right, and this V2 is the fourth intercostal left electrode, and V3 is the between the V2 and V4. And what is V4? V4 is the mid clavicular mid collarbone, while the V5 is the fifth intercostal space and anterior axillary line, and V6 is the fifth intercostal maxillary line. So anyhow, this is the pacemaker, and this is the depolarization will be occur after the depolarization, and in this way this is the cardiac muscle action potential, and in this way the cardiac muscle action potential through a pacemaker will be occur. Let's begin to understand the cardiac muscle action potential, because we just getting the overview of the electrocardiogram, and this is the cardiac muscle action potential, and in this way the cardiac muscle action potential through begin from the pacemaker cell and depolarization. So let's begin to understand the depolarization, and to transmit the signal after the depolarization will depolarize the contractile cell. So this is the phase 0. In this way the depolarization sodium rapidly into cell and the calcium slowly into cell. So the calcium slowly into the cell, and the sarcoplasmic reticulum which that is present in the contractile cell, which that is used for the contraction of the myocyte muscle, myofilament, for myofilament, the sarcomere. So calcium slowly into cell, and phase 1 to phase 2, phase 3 and phase 4 we will discuss in this manner. So in this way here you can see the phase 1, the sodium channel close. After the sodium channel will close, which that is transmit the signal, the calcium will increase to lead to depolarization, and this calcium will move through a junction. This junction is basically present, which that travel the calcium toward the contractile cell will lead to contraction, and the plateau phase will be occur. In this way the potassium rapidly out of cell and calcium slowly into cell. In this way the maintain the depolarization, when potassium will be out move out, and the maintain the depolarization, and the calcium from extracellular space and the sarcoplasmic reticulum is equal to plateau phase. Why? Because it is not the calcium only move inside, but the potassium rapidly out of cell. So that is why balancing will be occur slightly, and this is the T tubule. In this way the calcium will move also via RYR and DHPR receptor, and in this way will lead to calcium moving to the sarcoplasmic reticulum to efflux of the calcium, and in this way which that is efflux due to the calcium increase into the extracellular will bind with the actin filament, will lead to contraction through a troponin. And this is the phase 4. Phase 3 is basically the rapid depolarization, calcium channel close, and the potassium rapidly out of cell, and potassium sodium ions position reversed. In this way the potassium sodium reversed. And the phase 4 is the resting potential. In this is the resting potential, leaky potassium challenge sarcolemma impermeable to sodium, and long absolute refractory period in cardiac muscle cell. So the long absolute refractory period in cardiac muscle cell is due to phase 0 to a 3 phase. Second action potential cannot be initiated protective mechanism against the tetanus. So that is state maximal contraction. So to 0 to 3 three-phase second action potential cannot be initiated protective mechanism against tetanus. So that is why the state maximal contraction, and in this way the movement of heart, the contraction and relaxation of the heartbeat will be not equal and not correct, and in this way the heart attack will be occur in the tetanus person. So this is the basically binding after the four, and after this complete the contraction will lead to relaxation due to the move out the calcium, and one calcium will move out or ATP required active transport or exchanges transport through our 3 sodium move inside, as well as the 3 sodium will move inside and potassium will move out, and in this way the intracellular fluid and extracellular fluid of the cell. So let's begin to understand via a graph for understanding better. So in this way here is the vertical show the membrane potential in millivolt, while the horizontal show the time. So the time required in the millisecond we are not understanding the time, so you can understand with a graph. So in this way here, this is the line, dotted line is the threshold line. After the passing the threshold, when the calcium will increase and sodium will increase, will lead to depolarization of the cell, and after this the depolarization of the cell, the sodium channel close. After the sodium channel close, the phase 0 to phase, this is the depolarization phase, is the phase 0. After the phase 0, the sodium channel close and the phase 1 will be occur. In this phase 1, the calcium will be increased while the potassium is rapidly, drastically, slowly decreased, and in this the plateau phase will be occur. And this plateau phase mean the basically the sodium channel close, and in this way here is the phase 1. In this way you can understand as well, this is the basically the plateau phase. The plateau phase means that this is the phase 2. In this way the calcium will move inside more and the slowly, and the potassium will move out. To decrease the potassium will lead to prolonged depolarization, distinguishes the cardiac muscle cell from skeletal muscle cell. Why? Because the skeletal muscle cells not contain a low calcium channel, gated channel opening, and the potassium will move outside like this, and that is why the contraction is strong, is not occurring in the skeletal muscle, while that's differently you can understand. So anyhow, after the phase 2, the plateau phase, the phase 3 will be occur. In this phase, the phase 3 is the rapid repolarization will be occur. When the repolarization will be occur, in this way the potassium will be decreased in the cell and the calcium channel will be closed. After the calcium channel will be closed, and in this way the calcium channel will close, so the more calcium will not move and inside, and in this way the decreasing of the charge will lead to a threshold passing to move down and the resting potential. In this way, the leaky potassium channel will be open, will lead to move potassium inside, will cover recovery phase, and in this way, the recover the potassium again. So this is the refractory period. In this refractory period, the phase 0 to phase 3. So this is the basically you can understand. In this way, the refractory period can be long if the tetanus will be occurred. The tetanus basically 0 to 3 phase second. The basically action potential cannot be initiated protective mechanism against the tetanus. So in this way, basically is the this mechanism will not occur 0 to 3 phase. So that is why the depolarization will be not occur and the repolarization, so that is why it can be problem creation. So anyhow, I hope you make sense about these things, and this is the potassium, the leaky channel will lead to potassium move inside again after the exchanges of the potassium, and after the repolarization will be a rapid repolarization, and in this way you can understand. and we will next understand about the tetanus. So thank